My name is Kate Frost. My official title is Head of Patient and Public Involvement and Engagement, and I am based in Research and Innovation at Nottingham University Hospitals. And I am your host for today's event. This event is part of our Research Lounge series that was born out of conversations with our experts by experience, our public contributors, who wanted a safe space for sharing information and best practice in regard to accessibility and involvement in research, but also for research staff as well to come together with our patient contributors to have those meaningful and thought-provoking discussions. A few ground rules before we get started. So we are going to have a short presentation from our speaker today, which is Joy Watterson, who is going to be talking to our title slide here. So firstly, about projects she's been doing on empowering adults with learning disability to take part in research. So she'll be talking about the findings from that project, and then also will be leading on to talk about her current project, which is Adapt Falls for ethnic minorities. During the presentation, as I've said, our mantra here is that we want to encourage in participation in our sessions. So to reiterate, no question is a silly question. Please ask throughout the presentation by either popping a question in the chat or by raising your hand, and we'll make sure we come to you at an appropriate time. We'll also have time for questions and discussion after the presentation, and that is really when we encourage people to participate. So with that in mind, I will stop sharing and again introduce Joy, our speaker today. Hello, Joy.
Hello, can you hear me?
Oh, yes, I can hear you loud and clear.
Good.
Perfect. Thank you so much for joining us. And I will hand over to you if that's okay.
Thank you, Kate. Thanks for having me. Hello, everyone. My name is Joy Watterson. I work at Nottingham University Hospitals as a senior research officer and also currently SPCR PhD candidate at the University of Nottingham. So this afternoon, I'll speaking on two different projects, the Empower, that's just rounded off, and Adapt Falls, which has just started 2 months ago. So Adapt Falls is my PhD project. So it's going to run it started in October, so 2 months ago, for the next 3 years. And I want to use this medium to introduce this work and ask that if anyone, like Kate said earlier, is interested in being part of PPR, because we believe and we know that it is important that expert voices, people who have lived experiences, are included at every stage of the research so that we can be researching the needs of the people, not just doing anything of the heart. And so if you're interested, please just get in touch or pop your info on and we'll contact you. So I'll start from Empower now. And Kate, next slide, please. So Empower, how we developed it. So I worked with other researchers on this project and I led on it. First, we wrote a protocol. So a protocol kind of allows us to kind of state what we plan to do. And it is a way of kind of checking our accountability for the work. Did you actually do what you said you would do and stuff? So we wrote a protocol and published it in Open Science Framework, and you can see the link below. Then we conducted a scoping review. We had meetings with adult and with learning disabilities, their carers and people who support them, healthcare professionals, researchers, to kind of just find out how people support adults who have a learning disability to make decisions. We also conducted surveys, and we had co-production activities with adults who have learning disability at their centers. So 2 groups, Reach, Learning Disability Group, and I'm hoping that some of them are in this call today. If you're there, hi, and SPLAT as well, group, and I hope you're here, SPLAT group as well. They contributed to this work, and also one conversation commented on the work that we developed together. So the aim of the project was to find out how to support adults who have learning disability to make a decision. It was all about decision making, whether they would like to take part in research or not. So next slide, please. So we found a few things from the scoping review, and I kind of tried to kind of just summarize it and make it a little bit concise what we found. So from the scoping review, it was clear that easy reads and providing videos and photographs and doing some sort of signing and having face-to-face conversations were some of the key things that people had done or have used to support people with a learning disability about and making a decision. So I will kind of tell you or tie up how kind of different themes kind of came up in different things that we did. So from the scoping review, we can see these are the things that people had done or people felt that adults with learning disability will benefit from when we are presenting information to them. So next slide, please. So from the surveys and meeting, you could tell again that some things are kind of coming out as well, like easy read is coming up again, images are there, then there is videos of with Marketons and British Sign Language coming up, and there was trust coming up. Now we are having conversations and people begin to say the things that matters. Then there is online accessibility there. People wanted social media, they wanted family members or carers involved in those conversations. Next. So when we came round to the co-production activities, I don't know if you can see, this is one of the groups that we worked with. And you can see on the boards there, they've kind of said, so we asked the question, how do you decide to take part in research, or how could you be involved in research? How do we support you? And people kind of said stuff that will enable them to participate. They will talk about not being judged, their opinions being heard, and being listened to, be given enough time. So different things came up. So what we did next during this co-production meetings was to kind of pick points that I've kind of showed from when we did scoping review, to when we had meetings, to when we did surveys, to when we're having co-productions, what people are saying. So if you look underneath the whiteboards on your screen, you can see there are key things that we just wrote out, like video, marketing, song, dance, easy read, face-to-face leaflet. So these were the themes that coming up. So what we did during these conversations was to ask people to kind of vote on their preference. So you might see on the pictures, you can see maybe a green card on the table, someone holding it up. So that was a way of using Q methodology that we found from the scoping review to kind of explain or make people add their preference about something. So next slide, please, Kate. So this is like summarizing, bringing everything together from the voting. So they voted on adults with learning disabilities. They voted on how to distribute or present research information to them. So the things that kind of really came out from, so a total of 21 people took part in this exercise. And the key point that came out top are the ones that we've highlighted in yellow. So 19 people would prefer research information to be distributed via leaflets, and that leaflet should be in easy read format. So that's a presentation that 20 people wanted. 20 people also wanted a face-to-face conversation. So whether you are presenting the information to them or whether you're telling them about it, so both distribution are presenting it now, they want to have like a face-to-face interaction from this. If you all can remember that before COVID, most of the research was done in person, like face-to-face. So when COVID came, we kind of all went remotely, and now people want that human contact when you're having that research conversations. So the other interesting thing that came up The slide is gone. Thank you. I can see it now. So the other interesting thing that came up was Makaton. So the 17 people wanted information with some sort of sign language in it. Then 20 people wanted social media as a way to kind of tell them about the information. And 19 people wanted some sort of photographs or image or voice recording narrative, or and all those kind of image, some sort of image that people who have learning disability will understand should be on it as well. Next slide. So what we did next is we then synthesized all the information that we've gathered from right from the scoping review to having surveys, to having co-production and having meetings with healthcare professionals and stakeholders and everybody. So we kind of synthesized everything, and it came down to these three things. So how people want information presented to them. They wanted it in a video format with somebody who have a learning disability talking and with photographs displaying what's been said. They also wanted short animation. So they wanted the information very concise. So they wanted short animations, easy read information with symbols showing, and they also wanted a researcher talking and signing Makaton as well. So we worked with a creative agency called Crocodile House. So they helped us to provide this video, the three key themes that came up, which is the learning disability person talking about the project, short animation video, and the researcher talking about it. So they helped us produce these three videos, which we took back to the group that we've been working with to find out if we've captured what they told us and what their preference is. So they narrowed it down to two, which you can see on your screen. They wanted short animation video with easy read information, and they also wanted the researcher talking about the project or the research with easy read and signing Makaton. So what we did next is, can you go to the next slide, please? So what we now know is that adults with learning disability would like to be approached about research face-to-face or through social media with simple read information and allow a lot of time to think about what you're telling them or what their involvement or engagement would be. They also would like information to be in short animation video or a video of a researcher talking about the project. They will also like their family members to be involved. They also want to be respected. They want to be able to build trust with researchers during this process. So the next slide is going to be showing you how we have presented the research information to this group based on what they have told us. So if you can remember from the word start, we wanted to find out how to support adults with a learning disability, whether to on decision making about participating in research. So everything they've told us, so we've kind of produced it in the way they want information communicated to them. So we've kind of summarized this project, this whole project, empowering adults with learning disabilities to participate in research. Every work that we've done, we've summarized it in the format, in the way the group have told us is their preferred way to be informed about research. Thank you all for listening. And before I go into the Adapt 4s, I just wondered if anyone had any questions?
Yes, I mean, we've had some amazing comments in the chat, Joy, saying how inspirational the videos are, and Jamie has also just said that he is hoping to work in disability, so just like soaking it all in, and that it's so important, how important sign can be to some communities as well. Oh, and then just where does one start with people who want to be involved in research?
Ooh. Thank you all for your comments. Yes, I could contact you. If you're happy for us to contact you, then we can begin the conversations from there. I think when it comes to being involved, do you mean in PPI capacity or as a participant? Or we can discuss all of those. And yes, we would really love to have that conversation, because this is taking me into the next project now, which is still very in its infant stage. So I'm just kind of beginning now. So if you would like to kind of get involved in that project, in the designing it, in the questions, in whatever capacity, little or small, then that would be great. So what's the other comments coming
Yeah,
up?
yeah. So also just to add, I think for yourself, Joy, when you were looking at starting this project, you went to existing adults with learning disability, like
Great. Yeah.
community groups and support groups, and
Yeah.
approached them where they were. And I think starting off with this as a, not starting jumping in with this is my research project, it was right, we want to understand how to communicate best, how to
Oh,
communicate research best. So I think in regards to being bespoke to your population, to whom you want to involve, would you say, Joy, that going to them and being in their environment and asking them how they'd like you to communicate with them, that helped?
yeah,
Um,
absolutely. And I think the other, sorry, I get it now. And I
yeah.
think the other thing that was important was the fact that we didn't go to the groups, because one of the things that they said that was really great to hear was the fact that we didn't go to the group with a fully formed research idea, methods, and everything that we wanted to do. We went to the group saying, this is what we want to do, but how do you want us to do it? So it was a case of we've done literatures and we started having conversations. You know, when you start having chats with people, then different things start coming in that you haven't thought about before. So when we went to the group and said we want to kind of develop something that will enable people who have learning disability to make decision. So it was about decision making. You don't have to take part in research, but what can we do to kind of enable you to make an informed decision about participation? So they were happy that we didn't come with a fully formed research. We came asking them to help us, let's make it together. And that is the joy of this project. And one thing, so many things I've learned from this, but I never did sign language before. I went on a marketing training. It was really exciting. The people were a joy to work with. I learned to write
Mm.
easy read. Oh, I realized that my easy read was really not great. I didn't have none. If you, my easy read before I started this project on a scale of 1 to 10 is probably 1. So I've kind of learned a lot from the people because they are the experts in it. They live that life day in and out. You know, textbook understanding is different from the lived experiences. And I think that's what's important is all about going to these groups and telling them what you're thinking and let them help you develop it. I do not go to the groups with already formed idea. Go to them with an idea you want them to help you develop it, if that makes sense. I think that's the joy in co-production. You know, if
Yeah, absolutely, Joy. I think all of that is absolutely, best practice. And
yeah,
there's been even more comments. And Tracy Furlow said, our group reach felt like we had ownership from the beginning, Joy, by being involved
absolutely.
from the start. So
And
I
they were
think,
honestly that group
hmm,
reach, you know, when I left them, I get to my car, there is this something in me that I cannot understand. You feel that excitement. I learned a lot from those groups, from reach, from I learned a lot from them. And I will kind of really encourage researchers, whether it's a learning disability project or any other project you want to do, for you to have that impact, you need to really go to the group and have those conversations with them.
oh, and Paul has echoed that from Splat. So it's I mean, I can tell just like the enthusiasm, and it comes out in the videos as well. And I think, again, just people are saying how useful this is and that it should be. Hence, one of this event, disseminated and used. And I think that the use of Makaton as well, you know, just saying how refreshing and inspiring that is, and that it should be adopted more widely and probably more as a standard. I believe. Oh, we do have a hand gone off, so amazing. Anthony, I'd like to invite you to come in.
Yeah, good afternoon, everyone. Good afternoon. So I so much appreciate about this research. So I've been working with people with learning disability. So my only challenges about working with them is how to use sign language in communicating. I know that communication is very essential when working with people with learning disability. So I don't know, how do you get to learn all these signs within your research topic? Thank you.
Thank you, Anthony. I went on a Makaton training. I think, you know, with Makaton is different from British Sign Language in the sense that you just have to say the keywords in it. You're not signing the whole sentence that you're saying. So if your organization could kind of provide that opportunity for people to go on a day training just to learn the key things, I think is important. In communication, you don't have to know the whole, but just know the key words in your sentence. And I think people appreciate that as well, and it does go a long way.
Thank you very much.
You're welcome, Anthony.
Question, Joy. Was that costed into your grant application, or was it a free course, or because is this something that we should be considering when we are applying for our research funds, or that we should be asking our organisations to support us with in regard to accessibility?
So we didn't know Makaton would come up with from this work at all, so it wasn't costed. You know, when the research was being costed, it wasn't costed. But when we realized that, oh, it's come up and we have to, because one thing we were keen on doing as researchers for this project was to do what the people asked us to do. So if you don't want to do what people are asking, there's no point asking them, kind of thing. So when Makaton came up, so we thought, look, on the research fund, there is opportunity for training. So we have to find, oh, okay, can we use that for this kind of thing? So it was that training that we got. So that was how we kind of got that into it, so to speak. So it wasn't costed for Makaton, but there was an opportunity for training, and there was other funds that we could access so that we could get trained to deliver the work. So that was how it got funded. And I think organizations can be flexible. I would think that if for you to provide that service to people that is under your care involves you having some sort of sign language or Makaton training, I think speaking to your manager or whoever the project lead is a first way, is a good point to start from, and they might be able to support that training, because they will support you to get trained to take blood if it's needed in your role. So if signing is what is required for you to have that, have that communication to enable people to understand what you're saying, I think is doable within your own clinical context. So is what asking those questions. That's my suggestions.
Such an important and powerful point around, you know, if you needed training on venipuncture or taking bloods, you provide it, and this is an accessibility requirement. So there, absolutely. Brilliant. So I know Joy wants to is going to move on to speak about her current exciting project, and also as inspiring. So I just wanted to offer the opportunity. Anyone, there will be, obviously we'll keep this conversation open, so don't worry if you don't, you know, think of a question even once this session's over. But has anyone else got any final questions or comments before we move on to the current project? No, I can't see. Anyway, as I say, we'll keep the conversation open, but let's go back onto the topic. So shall I go to the next slide?
Yes, please. Okay.
There we go.
Okay, this is the new project, and I started this in October, so like 2 months in now. And the aim of the is a PhD work. And so the aim of the project was to kind of adapt the Action Force program for ethnic minority stroke survival. So I'll give you a bit of a background on how that came about. And so Action Force, so the comments are kind of making me fuss. So Action Force, so what is Action Force? So Action Force program is a fall management tool, and it manages falls by finding out what causes them and suggest ways to reduce the risk of falling. Next slide, please. So the current Action Force program is being used in care home settings and is like a standard of care now in care homes around Nottinghamshire, where they check, it's like a checklist of what the risk of my service user falling, how can this be reduced, is it medications, or is it their vision, or so there's so many things on that checklist that Action Force program look at. So how did my project come into this? So Action Force currently be used in care home and is being known to reduce falls by 43%, which is really good. And the primary study did not collect ethnicity data, and the feasibility study was 100% white participant, which means if we have a falls prevention intervention that is 43% effective and is being rolled out in care homes across the country or around Nottinghamshire, and the primary study, or the study that has kind of brought this on, did not check ethnicity data, and the feasibility was 100% wide. So how are we sure that it is kind of suitable for everyone? So can we actually really roll it out to all the population? Because we are a multi-diverse society, and every research that we do should have that element in it. So that is how my project came on. And what I plan to do is to take the same Action Force program and adapt it for ethnic minority groups, but it will be in the community. So the primary study was in a care home. I want to still use that model, but adapt it to a community setting, but for ethnic minority population. So we know its acceptability within that groups. Is it even usable to them? Will they use it? Will it prevent falls? So there's so many elements to that is going to be looked at. So it is still very at its infant stage, and I would really love PPI contributions in this. So what people's participation will involve we will discuss, ideally we will love people who have lived experiences of stroke, either as a stroke survivor or they support somebody who's had a stroke. We really want to ensure that areas of research that matters to ethnic minority group is looked at. So if we're looking at preventing falls within ethnic minority population, so we want to know which area of that we should be looking at. Should we be looking at their environment? Should we be looking at their mental well-being? Should we be looking at, we really want to look at everything holistically in that population. Also, we would like people to contribute at every step of this research process. That's why I'm kind of really throwing it out now to people, so that it can be shaped in the direction that we contribute or make people's life better, especially those people who've had stroke or people who support them. It would be ideal to hear their views now, so that we can research areas that matters to them to give them a better quality of life. So the PPI group will be supported in different ways, in whatever capacity they want to. You can contribute a little, you can contribute as much as you like. So even if you just want to contribute 10 minutes and that's all for the 3 years, that's fine. Whatever you can contribute is welcome, and we really want to involve a lot of people in there, so that we can shape it in the way that it will be suitable for people we're kind of trying to prevent falls in. And also the PPI group, and finally, the PPI group will decide how often or where they want the meetings to be held. And I think that's all about this project. Oh, PPI, sorry, PPI stands for patient and public involvement and engagement. So sorry about not saying what it is.
Oh, no,
first.
no.
And any questions about this, please?
Lovely. And I believe that is the end of the presentation, isn't it? So I'll stop sharing screen so we can see each other again. There we go. So I believe we have a few questions, and thank you so much. I think that has sparked people's imaginations as well. So our first question from Monica is, when you mention the community for ethnic falls model, is that in people's care homes instead of care homes?
Sorry, Kate.
Oh, you're okay.
So you want, so can you say the question again? Sorry.
Yeah, absolutely. So when you're talking about the community for the ethnic falls model, are you talking about that being in people's homes or in care homes?
So yes, that will be in people's home, because the project is being sponsored by this School of Primary Care Research. So School of Primary Care wants research in the community. So I think that is where PPI comes in. The first one was done in primary care. There is a phase study coming up now that will be done hospital based. So PPI will decide whether we're going into people's home or whether we're going to a community center kind of thing. So it's kind of really open. It's not set yet. So PPI contributions will help us kind of identify where the intervention should be done. Should it be done in the GP surgery, for example, or should it be in a community center, or should we go to people's homes? And so I think PPR will help us to shape that.
Absolutely. Thanks, Joy. I think I'm just posting your email address in the chat again.
Okay.
And I'll also, once we've wrapped up discussions, pop a slide up for you to sign up to our mailing list to find out more information about involvement, and also if you wanted to get involved in this project. I saw Grace, you did have your hand up, and I don't know if that was an error. It's gone down now, so I just wanted to make sure that I haven't missed you from asking a question. So please do let me know if you.
Okay, it's on to ask the question actually, but I sent it already to the chat.
Yeah. Okay, no problem. Yeah, have I asked the question? Has it been answered for you then?
No, I wanted to ask if there's going to be any pilot study before this. What's that?
Okay. Oh
Hi.
yes, I've seen you.
Actually, I wanted to also ask regarding this study, like if, for example, some of the PPI members like me who have been in PPI by mistake and who has been doing this PPI thing for about 2 years now, sometimes I feel like I want to get involved in research projects that I'm passionate about in various ways other than just talking to the researcher, like for example, because I've been asking a lot of researchers right now that how can I sort of give my input than just by talking, because sometimes I feel like I can be coherent more with writing, right? There are various forms of communication, and she was like, this is a very good question. I don't know why we don't have like much writing opportunities for PPI members, this and that, because maybe we find talking easier, which is understandable. But I just wanted to ask in this project as well, if like, for some some PPI members like myself who like to talk less and be involved more in writing, like if there is any sort of like, input that has to be given, or if there's any sort of opportunities, like kindly do let me know as well, because I don't know, I like writing. I know it's very difficult for researchers to answer this as well. I know that the logistics could be very complicated, like this and that and this formality and that formality. I'm just giving my own very simple organic question, and if there is any space, any opportunity, kindly let me know, because I feel like I can do more than just talking. So
Absolutely.
I'm not saying talking is bad, okay, but being an autistic, it's not always comfortable for me to just
Okay.
talk.
Okay. Thank you for that question. Shall I start with Grace first? You
Yeah.
asked about a pilot study. For the feasibility, there won't be a pilot study or feasibility study yet. So the PhD, the way it's designed is it will be a scoping review looking at the barriers and enablers to adapting force for any minority stroke survival. What we find from there with PPI contributions and stakeholders contributions, we'll discuss all of those. That is what we move into interview sessions where we'll kind of interview people who have these experiences and healthcare professionals who support them and their family members and support system, and get their perspective on how to adapt the action force if the current program we have is not suited, or not if we find that it's not suitable to them. So we'll adapt that together. And the next plan is to have a co-design. That's why we're not having like a pilot or a feasibility study, because we want to co-design what we find from scoping review with PPI contributions to the people, interview the people with lived experiences. Then what we find from that is to co-design what they think will work for them. After that, after we've co-designed it, we will do a proof of concept where we will now ask, is acceptability, is it feasible? So it is at that stage that we'll be looking at all those questions. Like the kind of question that you will ask when you're piloting something, and it's at the fourth work packages, that's how we call it, that we'll be asking those questions. So I will come to the questions from Aria about not just talking and writing. I would love the opportunity to have someone in the PPI be a co-author in this. I would love that. And I will be speaking, I've the conversations we had, I've spoken to my lead supervisor, and we're having a meeting next week. We will be kind of looking at, to do this, we need more money kind of thing, in case the needs people are paying, need funding, all of those things. So we will be discussing all of this, because I would like the paper that comes out, there is a PPI contributor as one of the authors in there. I would personally like that, based on the work I've had with different communities and with different groups. It is absolutely ideal that we have that. There was a project I did 2 years ago now that the paper is coming out. Although we couldn't add people, the PPI group, as a co-author for that, because they didn't contribute in that capacity, but we had to acknowledge them. But if you, as a contributor, PPI contributor, you're looking at becoming a co-authoring papers, that could be looked into and support. Like I said before, you can support little and you can support loads. So we would, as the PPI group comes together and people start saying what they want, then we can find ways of supporting and see how it works. Yeah, I will be asking those questions in my next supervision meeting. I will.
Yeah.
Thank you so much.
Not promising anything
awesome.
yet, but
yeah.
I will be having those conversations.
Yeah.
Yeah. Just to echo that, so because we're the patient, so I'm the patient public involvement team at Nottingham University Hospitals. Well, not just me, there's a team of us. So we encourage, so it's got to be what interests you, what you enjoy, and like Joy said, it's really about finding the right activity, and we want you to obviously feel infused and inspired. So we just want to make sure that we are matching the right activities to yourself. And if you enjoy writing, then that is absolutely something that we will facilitate, like Joy said, for co-authorship, but really getting you involved in maybe the more nitty-gritty of the research documentation, but also opportunities to write blog posts or share your experiences in different ways. So for as involvement, we do have at NUH our research volunteer program, which enables people not only to be involved in the research team as a partner, but for the first time will then kind of get through that red tape of bureaucracy in being formally affiliated to the hospital. So you can be face to face with patients, you can be co-analysing data, co-delivering data, delivering research. So we're really, with that, hoping to offer like a whole programme of activities for people to get involved as suits you.
This sounds also really great. So if we could just get a follow-up email, like just to like references on whom to email and which website to look for, that would be really great, because NIHR website is it's very heavy, filled with information.
Yeah, oh, I know, yeah.
Yeah, it's I kind of get lost. Where do I go now?
Absolutely. Yes, I'll send an email out after this. I've also been made aware that some of the emails from Eventbrite have been going to people's junk folders. So what we're going to work on as a team is making sure we're sending out things via our own emails as well, so nothing gets lost. So I appreciate that as well. Okay, I've just noticed there's only 3 minutes left. God, time flies when you're having fun. So, just seeing if we've missed any questions, Joy. So, okay. Jamie had asked, how do I reach out to you to find out about more information, and do you only take people from the UK? I'd love to help with your research.
Oh, amazing. So the research is, to be PPI contributor, you have to be in the UK for this ADAPT Falls. Is Jamie in the UK?
So for our involvement, we take people from internationally. So, Jamie, for us, if that is your criteria for the involvement for the Falls project, that's acceptable, because you have to focus on, the demographic. But for our involvement, yeah, we take people, it doesn't matter where you are in the world. You can sign up and get involved in our research. So I have posted in the chat signing up to our mailing list, and also our team's inbox, and of course we work very closely with Joy, and also our website as well for further information. But to note, our website is under some changes. Not everything is on there right now. Oh, Australia.
Yeah, Australia.
Oh,
okay. Before we go, Kate, can I just quickly thank, I could see Tracy from Reach is here and Paula from Splat is here. I just want to say a personal thank you to everyone from both group on behalf of the Empower team. Thank you so much. You actually make this happen. And I'm really delighted. I'm in fact privileged to be able to work with your groups. I just kind of saw them there.
Yeah, thank you, Joy, and it's been an absolute pleasure working with you too. So I hope we can work again together in the future. Thank you.
I'm looking forward to my next visit.
Yeah, thank you.
Yeah. Thank you, Paula. Thank you so much.
Oh, well, thank you so much, everyone. We'll send an email out. The recording will go up on our YouTube channel. I just want to thank you again for taking this time out of your day. We'll keep you posted on future events, and of course, if you have any questions, please don't hesitate to contact us through the information we've provided. So with that, I want to thank Joy as well. Thank you so much, Joy, for coming today, and I will just reiterate, inspirational work, like absolutely incredible. So, congratulations, and thanks again for sharing.
Oh, thank you, Kate, for having me.
No worries. So yes, we'll leave you there. But of course, we can carry on the conversations. Any questions once you've left, please don't hesitate to contact us to ask those. Conversation doesn't end here. And have a lovely rest of the day. So,
thank you. Thank you for having me. And thank you all for sharing your lunchtime with us.
Yeah. Bye. Thanks, everyone.
Yeah, thanks, Paula. Bye.